Welcome back, everybody. Today we're going deep on something a bit different, post-stroke depression.
PSD.
Yeah, PSD. And honestly, I had no idea how many people this affects.
Yeah, it's a big number. A lot of stroke survivors have to deal with this.
On top of everything else.
Exactly. And it can really impact their recovery.
So we've got like a mountain of research here.
Over 11,000 studies.
Yeah, 11,500 to be exact.
Wow.
From the last decade, all about acupuncture and PSD.
Mm-hmm.
Let's take away.
So what's really interesting is that it seems like acupuncture is really promising as a treatment for PSD.
Okay, so we're seeing some positive results.
Definitely.
In all these studies.
We're seeing a reduction in depressive symptoms.
Okay.
We're seeing improvement in neurological function and even some promising results in motor recovery.
Whoa. So it's hitting the problem from a few different angles.
It seems like it.
That's really interesting.
Yeah.
Now, before we get too deep into it, I have to ask, when we talk about acupuncture, are we talking about one thing or are there like different types?
That's a really good question. And actually, there are different types of acupuncture. And the research highlights a couple that seem to be particularly effective for PSD.
Okay.
One is electroacupuncture.
Okay.
And then the other is scalp acupuncture.
Electroacupuncture.
Yeah.
That sounds kind of intense.
It sounds a little bit intimidating, but it actually involves using a very mild electrical current along with needles.
Oh, so you put the needles in and then...
And then there's a little electrical stimulation as well.
Interesting. And what about scalp acupuncture? Does that actually involve putting needles in your scalp?
It does.
Really?
Yeah. So in scalp acupuncture, they use these very fine needles, and they target specific areas on the scalp that correspond to different motor and sensory functions in the brain.
Okay, so two really different techniques.
Mm-hmm.
But both showing some potential benefits.
Yeah.
What about beyond just like the mood scores? Did these studies look at things like medication use or overall how people were feeling?
Yeah, so they did. And this is what gets really interesting.
Okay.
Not only did people's depression scores improve with acupuncture, but they also reported needing less medication for their PSD.
Okay, that's huge.
Yeah. And on top of that, their overall quality of life improved.
So it's not just masking the problem, it's actually helping them to get back to their lives.
Exactly.
So we've talked about what it is and the fact that it seems to work, but now I'm really curious about how does sticking needles in your body actually lead to all of these improvements?
So there's still a lot that we're learning about exactly how acupuncture works, but research is highlighting a few mechanisms that might be involved.
Great.
One of them is neurotransmitter modulation. So it seems like acupuncture might actually be boosting the activity of key neurotransmitters.
So it's like a natural mood booster.
Yeah, you could think of it that way.
But with needles instead of chocolate.
Exactly.
I like the sound of that.
But it's not just mood that acupuncture might be impacting.
Okay.
Electroacupuncture in particular seems to also have an effect on neuroinflammation.
Neuroinflammation.
Yeah, so that's basically inflammation in the brain.
Okay. And that's related to depression.
It can be, yeah. So inflammation in the brain can actually disrupt normal brain function and contribute to things like depression.
I see.
And what's interesting is that electroacupuncture seems to be reducing these levels of specific inflammatory substances in the brain, like IL-1 and TNF-alpha.
So it's like calming the brain down.
Yeah, you could think of it that way.
Okay.
So yeah, those inflammatory substances are linked to PSD.
Okay, so we've got the neurotransmitters, we've got the inflammation. Anything else?
There is, and this one is really fascinating. It actually involves the gut.
The gut.
Yeah, so you've probably heard of the gut-brain axis, right? This connection between our gut and our brain.
Mm-hmm.
Well, it turns out that acupuncture might be playing a role in that connection as well.
The gut influencing the brain. You're blowing my mind here.
So think about it this way, right? Our gut is home to trillions of bacteria.
Yeah.
Some of them are good, some of them are not so good.
Mm-hmm.
And this gut microbiota, as it's called, it actually influences a lot of things in our body, including our brain function and our mood.
Oh, wow.
And what studies are showing is that acupuncture can actually shift the balance of bacteria in the gut.
So you're saying that sticking needles in my skin can change what's going on in my gut.
It seems like it.
And that, in turn, can affect my mental health.
It's pretty incredible.
Wild.
Yeah, it really highlights how interconnected our bodies are.
Totally.
What happens in one system can have a ripple effect on other systems, and acupuncture seems to be tapping into that somehow.
This is fascinating. All right, but let's get practical here.
Okay.
If someone is considering acupuncture for PSD, What about the frequency? How often do you need to go for these acupuncture sessions?
So that really depends on the individual and how severe their PSD is.
Okay.
So for more recent or more acute cases, daily sessions might be helpful. But for more chronic cases, a couple of times a week is usually sufficient.
Okay, so it's personalized,
Exactly.
like we were just talking about.
It's really about finding what works best for each individual.
Makes sense. It sounds like finding a really skilled acupuncturist is probably key here.
Absolutely. Someone who can really assess your individual needs and tailor the treatment accordingly. And that's what makes acupuncture so fascinating. It's this blend of these ancient principles with modern research and personalized care.
Yeah, it's not just cookie cutter.
No.
It's really individualized. I'm already seeing how acupuncture could be this multifaceted approach to treating PSD,
Yeah.
working on all those different levels that we talked about.
Yeah, and we're just getting started. Stay tuned for part 2, where we're going to dive into how acupuncture might be able to help with the physical challenges of stroke recovery.
Can't wait for that one. See you next time.
It's amazing how acupuncture can go beyond just treating PSD. You know,
Really?
researchers are even exploring its potential for addressing those physical limitations that stroke survivors often face,
Like, what do you mean?
like paralysis, difficulty with speech, things like that.
Well, hold on. So someone's struggling to move their arm and you're saying acupuncture might help.
The research is pretty promising.
But how does that even work?
Well, it goes back to that concept of ki and meridians, the energy pathways we talked about. In traditional Chinese medicine, a stroke is seen as this disruption of energy flow. And acupuncture is thought to help restore that balance.
So it's not that the needles are making the muscles move again. It's more like they're helping the body to heal itself.
Exactly. It's about creating the right conditions for the body's natural healing process to kick in.
I see.
And there's actually some research to support this when acupuncture is combined with conventional rehabilitation therapies like physical therapy. There's a significant improvement in motor function for stroke patients.
Okay, so it's like a powerful add-on to those traditional therapies.
Exactly.
I'm curious, are there like specific acupuncture points that are the go-tos for stroke rehab?
There are definitely points that are frequently used.
Huh?
One of them is Li4, also known as Hegu.
Hegu.
Yeah, it's located between the thumb and index finger.
Okay, Li4, Hegu. Why that spot?
So in traditional Chinese medicine, Li4 is considered a powerhouse for pain relief and boosting circulation. And it's also believed to have this strong connection to the brain and nervous system.
Okay, so stimulating Li4, it could potentially ease pain and help with neurological recovery.
Yeah, kind of like two birds with one stone.
That's amazing.
Another point that's frequently used is ST36 or Zuzanli.
Oh, that's the one on the leg, right?
Exactly the one we talked about for electroacupuncture.
So it's a multitasker.
ST36 is known for strengthening the body's overall energy and vitality, and it's thought to be really helpful for combating weakness and fatigue, which are common after a stroke.
Okay, so it's like a physical and mental energy boost point.
Exactly.
Very cool. Any other VIP points we should know about?
There are many, but another notable one is SP6 or Sanyinjiao.
SP6 Sanyinjiao. Got it.
Where is that one?
It's located on the inner leg, just above the ankle bone.
Okay, and what's SP6 known for?
So SP6 is often used to regulate blood flow and reduce swelling. It's also believed to have a calming effect on the nervous system,
which can be helpful for stroke patients who are experiencing anxiety or sleep disturbances.
So it's like a triple threat circulation, calming the nerves and sleep support.
Pretty much.
It sounds like acupuncturists have this whole toolkit of points they can use depending on what the person needs.
That's the beauty of acupuncture. It can be so personalized. The practitioner assesses the patient's specific symptoms and then selects the points that are most likely to benefit them.
So we've got the points and the theory behind them.
Yeah.
But what about the evidence? Are there studies specifically looking at acupuncture for stroke rehabilitation?
There is a growing body of research.
Okay.
One study that was published in the journal Stroke
Okay.
found that when acupuncture was added to conventional rehab, it significantly boosted motor function compared to rehab alone.
So we're not just talking about anecdotal evidence.
Oh, no.
There's actual science backing this up.
Exactly.
That's really promising.
Anything else stand out from that study?
They also found that acupuncture helped to reduce spasticity.
Spasticity? Yeah, that's that muscle stiffness and difficulty controlling movement that's common after a stroke.
So it's not just about getting movement back. It's about improving the quality of that movement.
Exactly.
That's amazing.
And another study, this one in neurorehabilitation and neurorepair, found that acupuncture improved balance and coordination in stroke patients.
Balance issues are a huge problem for a lot of stroke survivors.
Right. It can make even simple things like walking really difficult.
Yeah.
So if acupuncture can help with balance, it could make a huge difference in their lives.
Absolutely. And it sounds like the benefits go beyond just the physical stuff, too.
Right.
There's that mental and emotional component as well.
Exactly. Research has shown that acupuncture can reduce fatigue and improve sleep quality in stroke patients.
Which is huge because fatigue after a stroke can be debilitating.
Absolutely. It can really impact their quality of life.
Yeah, it's addressing those less obvious but equally important parts of recovery, like having the energy to do things, getting good sleep, that feeling of being able to cope.
Exactly. It's about treating the whole person, not just the stroke.
I love that holistic approach.
Mm-hmm.
But let's talk practicalities here.
Okay.
How soon after a stroke can someone actually start acupuncture?
That's a good question.
I imagine there's a window where it's most effective.
It's always best to discuss that with a healthcare professional to get specific guidance.
Sure.
But generally speaking, acupuncture can begin as soon as the patient is stable and medically cleared for treatment.
Okay, so it could be incorporated into the rehab process pretty early on.
Yes. And some studies even suggest that starting acupuncture earlier might lead to better outcomes.
Which makes sense, right? The sooner you start addressing those imbalances
Right.
and supporting the body's natural healing process,
Exactly.
the better.
Yeah.
But what about safety? Is acupuncture safe for stroke patients?
When performed by a qualified and experienced acupuncturist, it's generally considered very safe.
Okay.
The most common side effects are really minor things like bruising or soreness at the needle sites. Serious complications are very rare and usually due to improper technique.
That's good to know. So finding a qualified practitioner is super important.
Absolutely.
What else should people keep in mind?
It's really important to have an open and honest conversation with the acupuncturist
Okay.
about your specific needs and goals.
Mm-hmm.
Be upfront about your symptoms, your medical history, any medications you're taking.
Communication is key.
Always.
Just like with any healthcare provider.
Exactly.
This has been so informative. I feel like we've covered so much, but we're still just scratching the surface.
Yeah, there's so much more to explore. In part 3 of our deep dive, we'll delve into the cutting-edge research on acupuncture and stroke recovery, and we'll also offer some practical tips for finding a qualified practitioner and incorporating acupuncture into your overall treatment plan.
I can't wait. Stay tuned, listeners. We've got more fascinating insights coming up. We're back for the final part of our deep dive, and this is where it gets really interesting.
Yeah.
We've talked about acupuncture's potential for PSD and physical recovery,
Mm-hmm.
but now I want to know about the cutting-edge stuff. The future of acupuncture in stroke recovery.
Well, one area that's getting a lot of attention is research into how acupuncture actually affects the brain.
Okay.
Scientists are using things like fMRI to see what happens in the brain.
Whoa. So they can actually observe the brain responding to acupuncture in real time.
Exactly. It's pretty amazing.
That's incredible. What are they finding?
So one of the most exciting findings is that acupuncture seems to enhance neuroplasticity.
Neuroplasticity. Remind me what that is again.
It's the brain's ability to rewire itself after an injury.
Right. So after a stroke, the brain can actually adapt and form new connections.
Exactly, and acupuncture seems to be boosting that process.
So we're not just talking about treating symptoms here. We're talking about helping the brain to actually heal.
Right. It's potentially helping the brain to repair and recover.
That's a game changer.
And studies have shown that acupuncture can increase blood flow to the brain.
Okay.
It can stimulate the growth of new brain cells, even boost the release of growth factors that help with healing.
Whoa. It's like giving the brain a toolbox to rebuild itself.
That's a great way to put it.
This is really exciting stuff.
Yeah.
What else is on the horizon for acupuncture research?
Well, researchers are also looking at combining acupuncture with other cutting-edge therapies like stem cell transplantation.
Stem cells.
Yeah, those cells that can become any type of cell in the body.
Right. So the idea is that stem cells could potentially replace damaged brain cells after a stroke.
Exactly.
And you're saying combining that with acupuncture could make it even more effective.
Well, early research suggests that might be the case.
Wow, that's amazing. It's like science fiction becoming reality.
Yeah, it's a really exciting time to be in this field.
Absolutely. And it sounds like this is just the beginning,
Oh, yeah, there's so much research underway right now.
exploring all these different aspects of stroke recovery.
From speech difficulties to problems with swallowing.
It's incredible to think that something as ancient as acupuncture could hold so much promise for modern medicine.
I know, it's fascinating.
So for our listeners who are thinking about trying acupuncture for themselves or for a loved one, what advice would you give them?
The most important thing is to find a qualified and experienced acupuncturist,
Okay.
someone who specializes in treating stroke patients.
So it's not as simple as just opening the phone book.
No, you really want to do your research.
Right. Find someone with the right credentials and experience.
Exactly. Look for someone who's board certified and who has a proven track record in stroke rehab.
Got it. So credentials, experience key. Any other tips?
Yeah, it's crucial to have a really open conversation with the acupuncturist
Okay.
about your specific needs and goals. Be honest about your symptoms, medical history, medications you're taking.
Communication is key.
Always.
Just like with any healthcare provider.
Right.
Any other advice for first-timers?
Yeah, wearing loose, comfortable clothing is helpful.
Okay.
Something that allows easy access to the treatment areas.
Makes sense.
And you might want to avoid caffeine or heavy meals right before your session.
Good to know. I know some people are afraid of needles.
Uh-huh.
Any words of reassurance for them?
Acupuncture needles are incredibly thin.
Okay.
Much thinner than the needles used for injections.
Mm-hmm.
Most people feel very little sensation, if any, when they're inserted.
Okay.
And a skilled acupuncturist will always make the experience as comfortable as possible.
That's good to know. So it's not the scary experience some people might imagine.
Not at all.
I have to say, this deep dive has completely changed my perspective on acupuncture.
I'm glad to hear that.
It's not just some alternative therapy.
Right.
It's a powerful tool that can help people heal, recover, and regain their lives after a stroke.
Absolutely. And I think as research continues to uncover the mechanisms behind how acupuncture works, we're going to see even more innovative applications in the future.
I'm excited to see what the future holds. Thank you so much for sharing your expertise with us today.
It's been my pleasure.
And to our listeners, we encourage you to keep exploring this fascinating world.
Mm.
Maybe look into local acupuncturists. Research some of the points we've talked about. Share this knowledge with someone who might benefit from it.
Remember, there's always more to learn and discover.
And who knows, maybe acupuncture could be the key to unlocking greater healing and well-being for you or someone you love.
That's a great thought.
Thanks for joining us on this deep dive. We'll see you next time for another fascinating exploration.